how is it that you help people feel safe about exploring what's going on in their body? Because we are so rewarded in our society as adults for our cognitive ways of being in the world.
I think I'll have them do a self check-in every day and be like, what am I feeling? What do I need? And even if it's just, I need a glass of water, and I go give myself that thing, that's building a level of trust with the self first.
Welcome to the Mindfulness and Motion podcast, the show that helps you move beyond the checklist of life and into a world of joy and meaning and discovery. I'm your host, Cori Myka, and I'm excited to have you here today. In this episode, we have Lisa, who is a licensed professional clinical counselor and a board-certified dance movement therapist. So today we'll talk all about how dance can help you reconnect with your body, release pain, and feel good. Whether you're looking to move through grief, navigate anxiety, or simply bring more presence to your day, this is the conversation for you. So let's dive in. So Lisa, welcome. I'm really excited to have you here as a dancer because I have said for years and years and years, I would love to find a dance teacher, somebody who teaches dance the way I teach swimming.
Right.
Yeah. Our clients come to us and they have heart palpitations about going into the deep end of the pool, and we break that down to simple steps. I've never felt that way in the pool, but you put me out on a dance floor. Yeah, not so good.
So one of the things that's interesting, so I have an MA in dance therapy, and dance therapy is this wonderful combination of dance and movement and psychotherapy. So when people are not able to connect with their bodies, or it's really scary to connect with their bodies, of course, dance feels like far away, right? That feels really challenging. But dance therapy is all about movement. You don't have to be a dancer. It's more about how your body feels than what it looks like. And I think that's the part of dance that in Western culture we kind of get taken away, is that internal feeling versus what does it look like? Is it a pretty line? Am I doing the move correctly? And there's less of that, and it's more tapping into yourself and what's going on. So the dance piece of it is dance therapists are dancers and understand the value of movement and dance. And we also are able to analyze movement and observe movement. And we're not using it in the way you would with choreography, right? Where you're like, okay, I see this and I want you to give me this movement. It's more about, what does this movement that is presented in front of me mean about this person's mental health? Does that make sense?
It does. Totally makes sense. And I think that's why dance classes never work for me, because they're always about like, we're going to do the cha-cha and you step 1, 2, 3. And I'm like, okay, I can do step 1, 2, 3. Then you put the music on. It's anxiety all over the place. I'm like, I'd like you to help me deal with the anxiety while I'm out here.
Right.
Then we can deal with how to do the cha-cha, I think.
Yeah. And I think if we look at movement, our movement patterns, like how we move shows how we feel. And if we can influence how we move, we change how we feel. So a lot of it is looking at those patterns, that how we move through life. Like, are we, people that have their shoulders up to their ears, or maybe their chest is concave, or what? That to me, I would get curious and be like, is there something more going on? What is that person feeling right now? And then as a dance therapist, I might try on those movements. Okay, what does it feel? This is actually a great exercise to have people do. But if you take your hand and you put it in your chest and imagine like pushing into your chest, and then, try it with me right now. Yeah. Okay. Yep. And then like this kind of feeling, a lot of people that are depressed feel like this. Now try and move around or do anything like this. Try and type, Yeah. Mm-hmm. Do you feel how limited that is? Like,
absolutely.
What did you notice? Yeah. So it can be like these patterns of movement that we get stuck in, and that will reflect in our body. Like it becomes our habit, and that is reflective of what's going on in our brain.
Absolutely. Yeah. We talk a lot about in swimming. I'll bring in these metaphors that we use in daily life, like butterflies in our stomach, or we're feeling, cold feet. People start like, we wiggle our feet around, we get real wiggly, and this emotional language that connects to our bodies and what our body actually does. We have lots of phrases like that in everyday life.
Absolutely. I think every emotion starts in the body, right? Like think about having the weight of the world on your shoulders or all of these things. We use these metaphors because there's physical sensations that accompany the feelings. And those physical sensations are first clues into how we feel.
Yeah, for sure. Now, I know one of the things we talk about, I don't know if you talk to your folks about this or what language you use, but we'll talk a lot about 3 levels of feeling, 3 ways we talk about feeling. There's feel as emotion, there's feel as sensation, and feel as body reactions. And so that's one of our tools that we use to help drop people down into their body. I'm curious, do you use something like that or something different? How do you help people drop into their bodies?
I think just starting with like connecting with the physical sensations, right? And it'll be like, well, take a minute, breathe, notice what you're feeling, physically feeling. And that informs us. Even though a lot of times we'll ignore things. A lot of times people will come to me with anxiety or perhaps depression, and there's such a disconnect. So that first level of physical sensation kind of opens up the emotional, the feeling. And then, yes, of course, your body's reacting, but you're often reacting out of habit or you're reacting from where your nervous system is in that moment. If you're in a nervous system kind of like shut down versus like, all right, I'm hyperactivated, like I'm super activated. And you'll probably, I'm sure if you're teaching people to swim and helping them overcome that fear, because that fear is such a big thing, right? It's almost impossible to swim if you're really stiff and like completely like your muscles are all tight. You're going to get very tired very quickly. So I think that bridging the disconnect, right? The physical sensation and then what that can mean. And when you first have people connect with physical sensations, it's always, not always, but quite often it's very biological. Well, I'm hungry. I'm thirsty. Oh, I'm tired. Like those very basic things that people ignore. And then once you've taken care of those things, the emotional sensations can be more present, I believe.
Interesting. What comes to mind as we talk about this, when you say, gosh, people don't even connect with their physical sensations of hunger and thirst and those kinds of things. So how is it that you help people feel safe about exploring what's going on in their body? Because we are so rewarded in our society as adults for our cognitive ways of being in the world. So many people's work is very cognitive and up in their brain, so that people are disconnected from their bodies. So how do you create that space of safety or willingness for them to drop into their bodies?
I think I'll have them do a self-check-in every day and be like, how, what am I feeling? What do I need? Right? How am I feeling? What do I need? And it's like, oh, I'm hungry. So starting to build these little building blocks where people are tapping into what they need and giving themselves what they need. So it's almost like establishing trust with yourself. Like if you think about an infant, every time you cry, that infant cries, the mom hopefully goes and checks on them or feeds them or does what they need, attends to a need. And we're building that relationship with the self. Right? So how am I feeling? What do I need? And even if it's just, oh, I need a glass of water and I go give myself that thing, that's building a level of trust with the self first. And then secondly, I would say whatever I see in the body, I'm not going to jump into the deepest thing first, right? Just like with swimming, you're not going to be like, well, we're just going to dive in.
Jump into the deep end.
Jump in. Good luck. Bye. Yeah. And the whole nervous system is like, oh, okay. No, we're not going to do that. So we start with sensation and grounding and being like, well, what can you feel? And then I also do a lot of attachment work. So anchoring people in thinking of someone that feels safe to them. And if they can't think of a person, is there an animal? Is there a place? And then helping them to find that in the body. So before I would dive in and do deeper trauma work, I'm going to help them resource. And just like you would, I'm sure before anyone steps in the pool, they need to have a way to calm themselves down when they get scared. Right?
Yeah.
Because if they're already terrified and they're going in, it's just a recipe for disaster. So I think we start there and really reading. It might be a slow process. maybe even getting connected to the body takes a while. And that's okay too. And we take as long as it takes to feel connected and have little ways of feeling safe. And the wound, whatever, trauma is going to come up when you try and go for safety. A lot of times people are like, yeah, but this huge thing. And I'm like, yes, and it's there and we're going to work with it. But let's just focus on being right here and right now.
Yeah, that coming into the present moment where hopefully when they're in a room with you or standing next to the edge of the pool with me, to realize, yeah, there's nothing going wrong in this moment. Yeah. And the willingness to stay in this moment versus going to that future or past.
Well, it's so hard, right? And it's hard to train our brains. Like I tell people sometimes, like what keeps you safe doesn't make you happy, right? So your anxious brain that's going to be like, scan for threat, what's happening? That's not going to make you happy. That's not going to go towards your happiness, right? If you think about it, we have to almost retrain our brain to be like, what's going right in this moment? And then can I feel that? Can I feel that in my body?
That's so good. I love that. What keeps you safe doesn't make you happy. Yeah. I oftentimes use the analogy of we learn not to stick our hand in the fire, right? Because it's so dangerous. You get burned if you stick your hand in it. It's useful to learn to be safe, to keep your hand away from the fire. But we still want to be able to use the warmth of it, right? Feel the warmth of it, to be able to lean in, tune in to the power of it. And yeah, I don't know, that comes to me as it's a happy thing to feel that warmth, but we don't have to like dive all the way into it.
Yeah. Well, okay, I'll speak for myself. There's nothing that I love more and that I feel more supportive than doing like a back float in the ocean when it's gentle, right? Like that. If you think about the water kind of lifting you up and holding you. And that's actually a great metaphor if people have experienced that before, to be like, can you imagine people holding you, or if you can't think of people, like the water holding you and just gently. The agreement is basically the water is going to hold you up, right? But I'm not going to go in. I think scuba diving would be beyond me. I think I would kind of panic. That's a lot of water. That's, like, I bet it would be incredibly beautiful. But, so it can just be, there are levels to it. There are places that we are willing to go. And then there's places that we're not willing to go, or we might be willing to go after some time, but we don't have to go into everything right then,
Yeah, that's such great permission. You'd said it earlier about just going small, and you don't have to speed into all of it, to take it slow. I really find when working with people with anxiety, and I'd like to hear more from your experience, how paving the way of being very slow, very intentional in the beginning can really pay off in dividends, later on. That allowing a slowness in the beginning, it's not necessarily that it goes faster in some other place, but we just establish a new way of being with ourselves that allows access, that if we're trying to push to that new way of being, doesn't really happen, or can take longer to get there because we're so pushy. Is that what you see?
Yeah. I had a supervisor describe once being with a client, and the client was like, I want to heal, and just poured everything out. And then it was too much. In the next session, the client didn't show. And we run that risk. And sometimes we see that with clients who will become flooded with all of the bad feelings instead of titrating. Like I think it's Babette Rothschild. She has a book called The Body Remembers. And she talks about, I think I saw her do a video where you shake up a whole liter of soda. And then if you try and open it right away, you're going to it's going to splash all over you. And we're going to titrate and just open a little bit at a time. And that's kind of what we have to do with trauma. What you are describing is the foundation, the building blocks, the resourcing. I use the word resource a lot, but being able to ground yourself, being able to calm yourself down is what's going to make it easier later on.
Yeah, for sure. Because that's really what we're practicing, right? Is how to be able to ground ourselves through either the memory of a past trauma or whatever future event that you need to tackle in your life, or you want to tackle in your life.
Absolutely.
Yeah. So do people come purposely for the dance therapy, or they come to us for therapy and then you're like, I have this modality to offer you? Or how is it that people come to do this work with you?
Some people are into dance therapy, and that's perfect. I love that. And some people come because I work a lot with anxiety and trauma. And I also work with attachment styles. I don't know how familiar you are with that, but how we bond to other people. And especially in relationships, say if you have an anxious attachment style, something like dating, you would have a lot of anxiety when dating. So people come to me and we can just do verbal therapy, but I tend to incorporate the body even then. Like, what are you feeling? How's that? How do you know this is? So even if it's virtual, we're still going to sit in this and find ways to incorporate the body. And then I have people that are like, I think this dance therapy thing is for me. So I have that kind of range, which is wonderful. And I've worked quite a bit. I did inpatient psych for probably a long time, 5 years. And then I've worked in different settings. So I'm able to kind of adapt, right? So that's the thing. Like somebody might not be up for dance therapy at the beginning, but might be more open to it later. Some people might never, ever want that. And that's okay too. So.
Yeah. What does dance therapy look like? Right? Like, what is it?
Yeah, that's a
There the
great
first
question.
day. What does it look like?
So you come in and there's like, we do a little brief check-in on like, how are things going? What are you working on? What's coming up for you this week? So brief verbal check-in. And then I'll put on music and we'll do a movement warm-up. Warm-up is not focused on warming up just your body. It's more on how are you feeling? How are your body parts feeling? What emotions, sensations, thoughts, images are coming up as you move each body part. So it's a different way of doing a warm up. And based on what I see in movement and or what they told me at the beginning of the session, then I have a theme to work with. So I can do movement interventions based on that theme. And all the while I'm moving with the person. So it's not just like you're being watched, because I feel like that would be a very uncomfortable experience. Some people would be fine with it, but I think most people appreciate having someone move with you, but I'm attuning to what they're doing. I'm not like, we're going to do my movement today. It's because it's not about me, right? So that movement and that mirroring of what they're doing helps build like a kinesthetic empathy, like an empathy on a body level. So we have the meat of the session, just like you would in psychotherapy where you're talking about, but we might be moving instead of talking, or we might be doing a little bit of both. And then at the end, we have some kind of closure, either movement closure, but usually we talk about what we did in the session and kind of put everything together.
Nice. And then how do people end up carrying that into their lives? How does that relate into the practice of their life? How do they move that in?
Yeah, that's a great question. We live in our bodies, right? So our body is our vessel. So any change that we implement, we kind of take it with us because we're taking our body with us. So a lot of times it might just be starting to be more conscious of how they're moving, more conscious of what triggers them, being more connected. And sometimes I'll do homework too. Like, okay, your usual movement pattern might be to avoid eye contact and hurry past people. I want you to just focus and don't try the people with cell phones, because that's not going to be a win. But maybe just focus on making a little more eye contact, or what's it like when you slow down and take your shoulders away from your ears. And I want you to experiment with that this week and then kind of report back and tell me how it was.
Yeah.
So that can be a way to give like homework, really soft homework, right? In a sense.
Sure. Although it's so pivotal. And I know a big piece of what we're looking for in the water, and I think people in general in their lives, they're carrying anxiety or being triggered by things, is to create some space between their reactions to things and then how they want to respond. And that practice of having many times that is safe to just drop into your body, not because you're trying to do a big thing, but just being in the practice of coming in and noticing the body intermittent times during the day is very useful to start expand that time, that space. Is that something that your clients start to experience?
Yes. Right? The more experiences of safety and of feeling really good, and even if you can't take it in all the way, can you take in 1% more of that safety and then that feeling okay? That the more we can, I almost think about it as like taking it into your cells. Like imagine each little cell taking in a little bit of this good feeling, of this feeling safe. And that can be so pivotal because we don't realize it, but you walk down the street and you're giving off, I don't want to get too woo-woo, but like energy, or even just in how we're feeling, we're emanating that, we're sending it out. And we're also giving, nonverbal cues, our facial expressions, everything. And that shapes how people interact with us, even on a very minuscule level. So if we can create more safety in ourselves, we're going to attract more safe people. And we're going to have better interactions too.
Absolutely. Yeah. I don't think it's too woo to say that we put energy into the world. I mean, we just know it in terms of, going back to what you were talking about with the baby crying. That's a lot of energy reverberating into the world when they're crying, right? Or it's a different energy when they're laughing. So yeah, I think it's a pretty normal way of expressing this, right? That our bodies have energy and we're putting, and it gets reflected back to us.
I'm just thinking how I would approach, I'm not really a swimmer, right? I'm like, I love swimming. I can do a couple strokes, but I'm more of a like, if there's a dolphin and a manatee, I'm more of the bloop, 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 manatee, just kind of floating along. I feel no need for speed, but I love the water. I feel relaxed in it. It feels really nice. And I think if I were trying to create safety, like I have all these positive associations, you can hear me as I'm talking about it, right? And if I were trying to create safety for someone and the water's not their safe space, it's not their thing, I would think I would start with just feeling like, okay, can I get you to a place where you feel safe outside of the water? Maybe it's thinking of a partner or your best friend or even your dog. It doesn't matter, something that makes you feel safe. And then having you have those safe experiences in the water, right? Which is sounds like what you guys do. And that's why you go so slow. Like, can we build on each safe experience in the water? And it's much like what I'm doing, but I'm like, I'm trying to get you safe in your own body. Does that make sense?
Yes, absolutely. Absolutely. And at the end of the day, we're helping people get safe in their own bodies, because the idea most people come into with swimming is predicated on the idea, if I can move my arms and legs to get out, then I'm safe, because safety is about being out. And so it's not necessarily about being in and where you are and in your body. And so that's why I love this touch where you're having people practice just moments of coming back in and finding the safety within themselves so that they can go out and move about in the world and have that reflected back to them. Yeah, it's really neat. Now, one of the things you've mentioned a couple times is feeling happy or feeling good. Is this an outcome that you're looking for people, or is that kind of a driving factor of feeling happy or feeling good?
That's a good question, right? And I think it's kind of a more philosophical question in a sense, right? Should I expect to feel good all the time? And my answer to you is going to be no. I think that feeling good should be an option. One, you should be able to feel good, right? You should be able to connect with your body and feel good. And you should know if you're having a hard time, ways to shift towards feeling a bit better, right? But it's unlikely unless you numb all of your emotions. Yeah, right. If you're like, I don't want to feel bad ever, you're going to numb every single emotion, and that's feeling good as well. So maybe it's helping people learn to tolerate the feeling bad and know how to move towards feeling good, but having that whole, I want to say, spectrum of emotions that you can be in your body and feel. Does that make sense?
Absolutely. Absolutely. Yeah. Because normal life is all of the emotions, and to have a big life, able to experience all of the emotions, and perhaps to notice if you're stuck in a particular emotion or emotional pattern, be it I'm Miss Pollyanna, everything's happy and good.
And that's not great either.
Yeah, or I'm always on the side of anxiety and stress and moving about the world as if everything is falling apart all the time. Yeah.
I think I emphasize feeling good because when you ask someone how they're feeling, even in your body, a lot of times they'll go to the thing that hurts. Right? Again, the thing that keeps you safe is not the thing that makes you happy. So the thing like your back is hurting or something's going on or emotionally, and you go towards that because it's a signal. But we also need to be able, in order to regulate, to tap into the other parts. Even if you can't access good, can you access neutral? Like I haven't thought, like my back hurts. Okay. I can't think of anything that feels good. Okay. What's something you haven't thought about that isn't bothering you? Like your elbows or, and having that whole range. But we start with trying to get some of that grounding and that positivity, and not positivity in a cheesy way, but just we should feel sensations that are pleasurable as well as the things that hurt.
Yeah, giving attention to, as you'd said earlier, does my back need something? Is there something for me to do for my back right now? And if the answer is yes, okay, then you could give it to yourself. And how do my elbows feel? It's okay for me to feel my elbows or wherever else. Yeah. It reminds me, I talked with people who do a lot of work on body image and, the negative self-talk that we are so trained to have around the way our bodies look. And you can't just go from, I hate the way my body looks to, I think it's beautiful and amazing. But maybe it is, you start with, oh, the color of my eyes is nice. Or something neutral.
Neutral-ish. Yeah. Something that's not heavily charged, right? I remember Ronda Rousey. I don't know if you know her. She was a MMA fighter, maybe like big, like 10, 15 years ago, but I loved her thought on body image because when they train, they lose a lot of weight and it would be like, okay, I'm having a good ab day. But when she wasn't like training, it'd be like, well, I'm having a good butt day. Like she would not focus on any particular part and find something to compliment herself on. And I think part of the body image, and especially growing up in the 80s and 90s, there was such fixed body image. I think a lot of us are still recovering from that.
Yeah.
Right? Like this is the one shape you can be and you better look like Britney Spears. Like that's a tough ask for a lot of us, right?
Right.
So I think being able to try and find something to compliment, if it needs to be neutral, like I like my eyes or I have good hair, great, let's do that.
Yes. Yeah. And I love the permission to feel good. I think this is not something, well, and I should say feel good in a connected way. I guess there is a lot of permission in society to feel good in maybe a disconnected way. Like it's okay to feel good by drinking a whole bunch or by, doing some crazy, I think about there's so many videos inspiring people to do crazy physical stunts or something, which is maybe a feel good adrenaline. But how much reward is there for just simple feeling good? That it's okay to tune in and find simple ways in your day-to-day movements and process to feel good in your body.
Yeah. And to kind of piggyback off that, think about how much of our society is achievement oriented. You're allowed to feel good when you achieve this thing, when you make the $1 million, when you, get married, when you have the baby, when you do these things, you're allowed to feel good, but not in your just simple, quiet moments, like sitting, reading a book. Why can't you feel good then? Talking to a friend. Why can't you feel good then? I don't know. Like there's these really quiet moments, and why can't we just infuse our whole life with allowing ourselves to feel good and not just in pivotal moments or, like you said, in a disconnected way, it's almost like you said, chemically induced way, whether it's adrenaline or alcohol or whatever you want to put in there. Can we just feel good in the simple moments,
Yeah. Going back to that baby image, right? The baby just asking for its needs to be met and feeling good just by learning how to move their little arms and legs and being able to smile at other people to get them to smile back and be delighted in these very simple, wonderful things, and how we don't worry that they're going to stay in that mode of feeling good forever and never challenge themselves. They do all kinds of challenging things like learn how to walk and run and talk and all these things. Yeah. But they get to just relax into their bodies too.
And, as we grow up, there's no one that comes to meet our needs. So we have to meet those needs for ourselves. And that's part of learning to regulate and allow ourselves to feel good and to be okay being in charge of our emotions too.
Yeah. Nice. Well, is there anything else you would like to share about being a dance therapist or feeling good in your body or?
Yeah, I also do some dance therapy workshops, which I love doing. So if people are in the Bay Area, that's another thing. I do workshops for schools and corporations, and the focus can be more on, avoiding burnout, how to connect with yourself, building your emotional intelligence. And again, dance therapy is wonderful for that because everything starts in the body. So.
Very fun. And all in person. Do you work with people virtually too?
I do as well. Yeah. Especially it's harder for me, right? Because I'm trying to observe movement and I'm like, okay, I've got your torso to your right. So I've got like your torso up to your head, and I'll have people scoot their camera back. But no, I've been able to adapt with COVID and having to do some virtually. So I do some dance therapy workshops virtually, and then I do more in person, which I think, of course, is my preference. But, we have to work with what people are able to do. And especially if it's for the dance therapy workshops in a different state or something like that.
Nice. Fun. Well, and Lisa, how can people find you? They are in the Bay Area.
Yeah. Yes. Or anywhere. My website is lisamanca.com, and my last name is spelled Manca. And you can reach out to me through there.
Great. And of course, we'll have that in the show notes as well. Yeah. Lisa, thank you so much for being here. And you inspired me and got me curious. Gosh, I'd love to get into do dance therapy just in that, because for me, it actually stirs up a level of anxiety that I don't have in other places. So I feel like, it's a perfect playground to be able to dip into. Yeah. It's something I oftentimes say about my swim students. Oh, it's so actually neat that they have this thing that they don't know how to do, because it gives them, a very clear playground in which to experiment with their emotional and physical life. So it can be fun to lean into these things and to see where they can take you. So,
and I feel like as adults, we're like, I do this, and then we don't put ourselves in the learning space a lot, right? A lot of times we're like, no, I don't want to go into that space. I have my 3 activities that I'm good at or I've done since I was young. So yeah, it is really rich for that. But I'm sure there's lots of dance therapists in Seattle, and I'm happy to connect you if that ends up being something you're into. So yeah.
Nice. Well, thank you so much for being here.
Yeah. Thank you. All
All
right.
right.
Take care.